Hello and welcome back to Beyond Entrepreneur. Today I'm so excited for our guest, Logan Andrews. Thank you so much for joining me today. I appreciate it. And we're here to talk about your business that you created and how successful you've been in it. So I guess I want to jump right into before you decided to create your business. What were you doing? What was your job? What was the inspiration?
So I actually started out working as a director of nursing at a long-term care facility locally, right here. Actually, it's in Fanning Springs, Tri-County Nursing and Rehabilitation Center, and it's an 80-bed skilled nursing facility, also long-term care, also known as a nursing home for some people that don't know what a skilled nursing facility is. But anyways, I worked there for about 10 years, and during that time at working as a director of nursing, one of our big focuses was to reduce unavoidable and unnecessary hospitalizations. So one of the ways that we kind of started doing that was I did a complete analysis to figure out why we were having so many rehospitalizations. And I found different things. Long story short, though, one of the things I identified was that a lot of patients were overutilizing the ER because they're using it as their primary care. Whenever they should have been using their primary care. So when I tried to look into that and dug a little bit deeper to figure out the why, I found out it was because a lot of these patients were just totally unable to make it out to the office, to like a traditional brick and mortar office. So that made me want to start doing house calls. So I was like, why is nobody already doing this? So I couldn't find anybody that was doing it when I was trying to refer these patients. So I said, why don't I just become a part of the solution? So I went back to school, became an NP, continued to work there as a director of nursing for a little while, and was moonlighting on the side by seeing patients. And that's kind of what led me to do what I do today.
I absolutely love it. What is your business called? What's the name of it?
So it's Andrews Healthcare Consulting, and that's pretty much our in-home primary care and mental health. We also have a brick and mortar office as well, Tri-County Internal Medicine and Family Practice, which is our main primary care office, which we have 4 offices, one in Williston, one there in Fanning Springs, one in Trenton, and we have one that's psych only, which is like more or less a satellite office, which is in Lake City.
Okay. And what does your business, like, how did it fix the issues that you were noticing when you were working as director of nursing?
So whenever I was still working as a director of nursing and working as a healthcare provider in my role that I'm doing now together, it started really helping our rehospitalization numbers for the nursing home. So in about a year's time after doing that, because I worked there for a year doing both jobs before I stepped down completely as the director of nursing. But during that time, we actually saw some of the lowest rehospitalization rates we've ever had.
Wow.
And actually, Tri-County Nursing Home was one of the 3 lowest in the entire state of Florida for rehospitalizations during that time.
That's absolutely incredible. And I understand that you provide a very wide variety of services as well. Can you go a little bit into that, of what kind of services, that it's not just, come and kind of do one thing, that it's very, has a very wide variety? Yeah.
So we do, of course, primary care. So we come in the home. That's just like what you'd get at any doctor's office, right? So we do that. We do that in the home. We do it at our clinic spaces. We also do mental health. So mental health kind of encompasses a lot of stuff as well. That also includes counseling, so mental health counseling. It also includes psychiatric evaluations by psychiatric mental health nurse practitioners. So they're more or less like a psychiatrist, meaning they're the ones that can write prescriptions. So like if you need medications for your depression, if you need medications for your bipolarism, insomnia, any of those things that kind of fall under mental health, that's what they can do. We also have some cash-based services too, from hormone replacement therapy to weight loss therapy. That's just a few things that we do. We also do some wound care for our patients that we see in the home and in our clinic. That's part of our primary care. If it's obviously too complex, we generally refer out to some of the other partners that we have in the community to do wound care. But we try to do everything that can be done in a traditional doctor's office in the patient's home. So sometimes that means x-rays, blood work, ultrasounds, EKGs, all right there in the house.
Which is absolutely great. I've never heard of that before. I've heard of telemed and like the telehealth where you can just do a FaceTime call, but being able to actually have someone come to your home, especially for those who are elderly and cannot drive, I can't even imagine just the long list of benefits and better experiences I'm sure from that as well. When you decided that you wanted to start this, what was your first step going into creating your own business?
Wow. So really was, can I do this was my first thing I thought of.
Mm-hmm.
And that was like, what do I need to have to do this? So,
Yeah.
you know, being a healthcare provider, I was thinking I had to have a license and all this kind of stuff. Well, I'm already licensed. I'm a licensed nurse practitioner, so I didn't have to have necessarily a specific business license.
Mm-hmm.
So that was the one thing I figured out. And then of course you have to make sure you have malpractice insurance. But honestly, by starting the house calls, that was probably the best thing to do because it literally required pretty much no capital to get started.
Okay.
I mean, I already had a car. That was pretty much my office. I already had a stethoscope. So, you know, there wasn't really a whole lot of stuff I had to buy. And then it was just getting all the partnerships that I have now with some of these third parties that we use for x-rays. So we don't own the x-ray machines or nothing. It's a third party company that we use. They bill the patient's insurance. They don't have to pay anything for it. Same way with the blood work, all that stuff. So all that was just added things in addition to what we're able to do that I found out wasn't going to cost me any kind of money to get started. So that was great. And then of course, once I started making money and stuff, then I was like, okay, now I can open up a brick and mortar office.
Yeah.
Versus beforehand, I probably would have had a lot of harder time doing that because I would have had to take out business loans or something of that nature.
Good.
So
Yeah. What were your biggest issues when starting out? Did you have anything that kind of was frustrating to deal with when starting the company?
Absolutely, and it's ongoing and still frustrating. It has to do with insurances. So in the medical world, we have to, and before we can just see a patient and bill their insurance, right? You have to be what's called credentialed and contracted with that insurance, meaning they have to accept you as a provider to be able to provide services to their patients. So one of the ones we still to this day have the hardest time with is Blue Cross Blue Shield, Anthem, Florida Blue, whatever you want to call it. They're all under pretty much the same umbrella. They have had their market area closed here in this area for years and years and years. We've been applying since 2021 and they keep telling us every year to reapply. They keep saying, well, you know, there's enough providers in your area. So I told them, I was like, well, how many providers are in our area? They said in the Tri-County area alone, there was over 200 primary care providers. I don't know when they last updated that, but last I checked, there's definitely not 200 primary care providers in the Tri-County area. I mean, Dixie County alone only has like 2 primary care offices, not including our office that does house calls. So, I mean, something doesn't add up.
That's not really adding up at all. Yeah, to get a doctor's appointment here, I have definitely had to wait well over a month, and that's with like all offices and everything, and I'm like, guys, please, I think I just have strep throat, and then I have to go to the urgent care and then spend more, and I can't imagine how frustrating that is from your end.
Oh, extremely. And then, of course, we can still see those patients. No, don't get me wrong. It doesn't mean we can't see them. We're not going to get paid for their services. So then, of course, we're having to bill them privately.
Yes.
But that can get expensive, especially if you're wanting to see somebody that your insurance doesn't take. And then when you throw a HMO plan on top of that, well, now there's so many roadblocks in front of you because say I needed to refer you over to a specialist. You have an HMO, right, and you're seeing me private pay, which is fine. I go to refer you to that specialist. Well, I have to refer you through the insurance company's system, which I don't have access to because I'm not a in-network provider. So now you have to go see somebody else that's in-network just to get that referral that you need.
That sounds so frustrating and like a lot of just time-consuming nonsense almost in a sense.
It is.
How have you stayed positive with that though? Because I feel like sometimes I get frustrated easily and I'd be like, ugh.
Well, I mean, there's other insurances that we are able to take, so I mean, it's not a big deal. If it was the only thing that I was able to accept or be able to see, I would probably be in a much worse place, because obviously you're not going to get paid. It's going to hinder a lot of the care that you need for some of these patients. But one of the things that really helped me to stay positive is I became really active in the Florida Association of Nurse Practitioners, and I learned that they had a legislative committee and all this stuff to really start combating some of these stupid issues that plague our state, even our nation, with things, especially healthcare related.
Yeah.
And because of that, I decided I wanted to get more involved. So from just me doing what I do and them learning about me, they actually asked me to become an at-large board member and if I would apply.
Wow.
So I did, and then I actually got nominated to be an at-large board member for the Florida Association of Nurse Practitioners. And they also asked me then to be on their legislative task force, which there's only 6 of us on this legislative task force. And we meet every so often at the Capitol. We went up there for A&A days, which was like for the American Nurses Association, their lobbying days. And we went up there and lobbied for different things. One of the big ones that we were doing was, it was House Bill 883, which allows psychiatric mental health nurse practitioners to work autonomously of physicians. And that's huge, especially in this area. So being from a small town, rural like this, mental health is almost impossible to find.
Yes.
And then trying to get into the specialist, which is what mental health is considered, is even harder. So, and then a few years ago, I actually lost a little cousin here in town to suicide, and that really sparked it that much harder for me to really want to really fight this and make it where it would really break down a lot of these barriers.
Yeah.
So that also inspired me to want to expand my psych side of my business, but that's a whole other story. But anyways, we become really active with that, and because of that, we were able to get House Bill 883 passed in the House and moved on to the Senate.
That's incredible.
We're hoping and praying it'll pass the Senate. If it does, then it's going to move to the governor's desk, which we already know he's very favorable of nurse practitioners.
Yes.
So, but that's one way that I try to stay positive, because I'm like, instead of just looking at the negative, try to figure out a way to make a solution and, give it your all.
Absolutely, and I agree with, like, mental health is very much overlooked, and I definitely would say in small towns, from living in a big city in Texas for a long time and then moving here, I'm like, whoa, I was in therapy for 9 years and then I moved here and I was like, what do you mean there's one singular therapist close to me and that they're booked out, that I could only see them once every 2 months? I was like, oh my gosh, it was almost a shock to me for that. And so I definitely think you bringing awareness and light to the situation, especially in smaller towns where it's overlooked and not as accessible, is very important, because there's, like I was saying earlier, telemed and over the phone, you only get so much of a connection, in my opinion.
100%, yes.
And when you're in the room with someone and actually there, you can have a much deeper connection. And I would relay connection to experience as well. So I'm sure that builds a much more positive experience in people's eyes than just going over the phone and being like, hey, I'm struggling, and then being like, well, it's you can only do so much over screens. So I think keeping it person to person and keeping that value rather than pushing more towards that is very important. And you've done a lot. How long has your business been open now?
So I actually started in October of 2021, October 1st to be exact. So started then, October 1st of 2021, it was just me.
Wow.
I started it by myself. And slowly grew to where I needed more help. And fast forward to today, in what is this, April 29th of 2025, and we have right at 21 providers in our group.
Wow.
I have 9 office staff, and we have a little over 5,000 patients that we see total now.
That's incredible.
So, I mean, it's really grown, because I was not, and by the way, when I started this, this was not my intention to do anything that's going on right now that I'm doing.
That was my next question to
No.
you. Is, did you always see yourself
No.
opening a business?
Not at all. It was just me. I was planning on doing this just like me, but then
Mm-hmm.
I kept having more people and more people asking, more people asking. I'm like, look, I'm only one person. I can't do
Yeah.
all this. So that's what led me to have to hire other people to help me.
Yeah.
And I had a hard time. I have a hard time telling people no, especially whenever they're in need and I see how bad they need help.
Yeah.
So that's when I was like, I need to hire other people to help me and train them to do what I do. So I mean, now we cover right at 18 counties throughout rural and central Florida. We just recently started covering Orlando and Kissimmee.
That's incredible.
We have another group that approached us and asked us if we could take them on as well with their providers. So if we do, then we'll start having Miami-Dade, Palm Beach, and Broward counties covered.
Wow.
So
just continuously just growing.
yeah.
That's so exciting. That's so incredible. And I'm sure that obviously your passion for helping others is what led you to this. Seeing the need for change and actually doing it is something scary. Taking that actual leap and being like, okay, well, no one else is doing it, so I'm going to be the one to stand out and do it. That's a scary thing, and I feel like a lot of the younger kids out there that want to do something, create their own business, fear is a big hill that a lot of them can't get over. What kind of advice would you give to those who are just kind of strapped down by fear, for those who want to start a business, especially in the medical field as well? Because I feel like everything's so set in stone with regulation and the laws and everything that it's almost harder to start your own business in the medical field than it is a grocery store or something else like that.
Well, that's what I thought too until I started looking into it and I realized it wasn't. So, I mean, it's just the main thing is just, especially if you're going to do something in the medical field, is just knowing what the regulations are, knowing what the rules are, knowing what you are and are not allowed to do, which, I mean, you can get online and look at that kind of stuff up pretty easy. But the biggest thing is, I mean, if you want to do something on your own, then that's always better than working for someone technically, if you could. That's why, like, the way that I design my practice is actually all the providers that work with us, they're all contracted and they all get paid basically off the amount of revenue that they generate. So it's totally different than a traditional way that a medical practice is ran.
Yeah.
Which I feel like, and I think my patients, our patients would attest to that they're more caring because their heart's in it more, because obviously you're not worried. It's not a number that you're trying to meet. Like with a lot of the corporate structure, you get paid based on how many patients that you see, or you get paid by the hour type of thing. With this, you're actually getting paid for the quality of care that you're providing and the level of care that you're providing. So I feel like that's why our providers provide that higher level of care. But the main thing is just finding what it is that you one, like to do or love to do, and then how you can expand that and turn it into something. So don't just settle for one. Number one, figure out what it is that you really like to do and figure out a way to capitalize on it and turn it into something. And that's would be my piece of advice.
Yeah, I love that. Did you have anyone that was your mentor, anyone that you looked up to that kind of gave you that extra confidence when you were first starting your business?
You know, when I was first starting my medical practice, there was a physician that I worked with, and I feel like I gained a lot of, insight from him. Him and I don't work together anymore. Had a falling out a long time ago, but I felt like I learned a lot from him. Really respected the way that he looked at things, and that's kind of how I got some of the ideas that I did to do some of the things that I do, because his thing was like always trying to figure out a solution to the problem. That's kind of where I got that from. And then, there's also another good friend of mine, one of the guys that I used to work with or work for at the rehab facility. And I mean, he was always like, he gave it 110%. He really valued his employees. I know sometimes the employees felt like they probably we're not valued because, I mean, you feel like that a lot of time in healthcare because you're about run ragged working.
Yeah.
Because there's never enough healthcare staff. But he truly did value his staff, and I saw that in the way that he talked, the way that he acted, and that was where I kind of learned that whenever you really show that you value your employees, you're really going to have, really harder working employees.
Yeah.
So he definitely would be somebody else that I would say I looked up to too.
I think when people are passionate about their career, it shows. And learning from others who have been doing it a lot longer is probably one of my favorite ways to learn, is through those who are so experienced. And that's why I love doing this, because I get to see all of these different perspectives and people. I just recently had Mel Bledsoe, he's a professor for EMS, and telling me all about his stories and all the things that he's done. And I love talking to people that I can feel the passion and love for what they do, especially in the medical field, because I feel like we've all had a bad experience with a nurse or with a doctor being in that kind of, oh wow, I don't even think they kind of care about me in and out. And it's not their fault. I get that, I am not a nurse, I am not in the medical profession, but I couldn't imagine being in their shoes of everything that they're responsible for and handle. So to be passionate and still love doing that speaks volumes, in my opinion. I think that also translates to a lot of your success that you've had. You said that you're also about to speak at the nurse practitioner. What are you giving the whole speech about?
So actually, I'm speaking at the Florida Association of Nurse Practitioners annual conference. It actually starts tomorrow, so I'm driving down in the morning.
Oh, that's so exciting!
So tomorrow is actually some of their skills labs. So I'm going to do a skills lab tomorrow, but then I'm actually speaking, I believe it is on Friday, actually, and I'm speaking on the entrepreneur track. So they have two tracks. They have a clinical track and they have an entrepreneurial track. And I'm actually going to be speaking on starting an MP-based practice, meaning starting a nurse practitioner-based practice and how to. So
that's incredible.
Yeah, I'll be giving a kind of hour-long lecture on how to start a nurse practitioner-based practice and what that looks like specifically for Florida.
Yeah, I think that's so incredible. Do you ever get scared to talk in front of all these people?
No, not really, not anymore. I mean, I was very active with stuff in school from, I was the FFA president in high school, and I really learned a lot about parliamentary procedure then, so I did that. I did different competitions through them. Beta Club, I was doing that. HOSA.
So you've been experienced with talking to public at public presentations.
Oh yeah, and I just spoke at a national conference in New Mexico about a month ago. Wow. Which was for the National Nurse Practitioner Entrepreneur Network, which is nothing but a huge, big group of nurse practitioners that are all business owners. And I was speaking to them about innovative care models.
Yeah.
So, there was that, and then go back a little bit further. I was in Boston actually a week before that conference, and in Boston I was speaking out there. I was a panelist for this group, and there was people there from Johns Hopkins University, Emory, Columbia University, Rhode Island University. There's some people there that represented the Centers of Medicare and Medicaid Services. Some big CEOs from a couple different big health plans were there to ask us questions. Some accountable care organizations, managed service organizations were there, and it was actually, there were only 14 practice owners throughout the entire nation that were selected, and I was one of them, and I actually had to be a panelist for all these people to ask us questions on things. So, because they're trying to figure out solutions to our current healthcare system, and one of the big solutions they found is nurse practitioners, because there's way more of us than there are of physicians. But one little thing that most people don't realize is that nurse practitioners, if we see you as a patient and we bill for a service on the physician fee schedule that pays $100, because we're a nurse practitioner, we only get paid $85. So whenever you see a nurse practitioner, it's basically a 15% discount, even though we are doing 100% of the work.
Yeah.
And even though my staffing cost, I don't get a 15% discount.
Yeah.
And my supply orders that I place are not at a 15%
get a discount either.
So that's one of the things that we were kind of talking about there.
Mm-hmm.
And it was a big study that was put on by Columbia University and Brandeis University.
Mm-hmm.
And it was funded by the American Nurses Foundation. So that was pretty neat to actually be a part of that. And now we actually, all of us, decided we wanted to continue that, and we are now. And the National Nurse Practitioner Entrepreneur Network is actually the one hosting these bi-monthly, or I'm sorry, we meet 3 times, or quarterly a year. We meet quarterly to discuss all the challenges that are facing nurse practitioners, how we can do that, and how we can be involved with different state organizations and federal organizations to try to get different legislations passed.
That's insane. You're not just changing the Tri-County area, you're possibly you're changing the entire United States.
Yeah, we're working on a lot of stuff. Yeah.
That's insane. That I couldn't even, it's hard to even wrap my head around all of that. That's so crazy. I'm literally wow, I'm so honored. Thank you so much for coming in. I'm like, oh my gosh. I couldn't even imagine, but I can only say how much more that probably makes you want to keep going, and also a huge motivation to be able to do these things and be involved in not only just our community, but the whole nation's community as a whole. How would you say that has played to your success, being involved and doing all these things? Because you could just say no, and you could just not be doing that.
Yeah, I could easily just say no and not worry about it and just stay in my little area. But I look at, if I don't do something, it's going to affect us one way or the other. So I would rather be a part of what's going to be affecting us in more of a positive way, to have that voice, because we don't really have that voice here in our rural areas. Yeah. So I figured that would be one way to do that. And I found out that there are so many other people that think the same way. So believe it or not, out of those 14 practices, hardly any of them, maybe 1, 2 tops, was actually from a urban area. Almost every one of them was from rural areas throughout the nation. And that's because us as nurse practitioners provide 99.9% of the care in a lot of these rural and underserved communities. So I really want to see it for the good. I want to see I want to see some changes for the positive for us. And I know that if I wasn't involved, then it's going to affect us one way or another.
Yeah, absolutely. Since you're so busy, you're constantly doing things, how do you balance your work life between your personal life? How do you keep that?
Oh, it's quite hard. So actually, my family is coming with me to Orlando.
Awesome.
We're staying at Disney World.
Oh,
so
fun.
My 4 kids and my wife will be with me. And they will be hanging out at Disney while I am at the conference. Then at the end of the conference each day, I'll go meet with them. We'll go hang out by the pool or go walk around Disney World for a little bit. So I try to always be there and incorporate them in stuff like this. So when I go to some of these conferences, they actually were supposed to go with me to New Mexico, but my son ended up getting sick literally 2 days before. So my wife and them ended up staying back. But anyways, I always try to bring them, because otherwise I would be too busy to try to do anything. But I always try to reserve weekends to be with my family. I've gotten now to the point where I've gotten so busy that I'm actually trying to have more of administrative days during the week, to where I'm not necessarily seeing patients, I'm doing more administrative work. That's made a huge difference. And then this wonderful tool called artificial intelligence has helped with a lot of my scribing, so a lot of my documenting, which used to take me hours, versus now it'll do everything for me, and I just turn it on my iPad and then bam, it's done by the time I get done with my patient. So it makes it way easier. So
I bet, that definitely is helpful. AI has been crazy blessing to some extent. Yeah. To some extent. People can go a little too far, but with stuff like that sounds very helpful with, I can't even imagine all the paperwork that y'all have to do.
Oh yeah, there's lots, especially when you come in with the insurance.
I
mean,
with the insurance.
Oh yeah.
I couldn't imagine. Well, I guess do you have any anything for our listeners about any just motivational things that you want to say before we end this podcast? Any just final words?
Yeah, I would say, like I said earlier, if you're thinking about starting a business, definitely go for it. Weigh the pros and cons of what it is that you plan on doing, but make sure whatever it is that you do, that it's something that you enjoy doing, because you definitely do not want to be a slave to something that you do not enjoy. So make sure it's something you enjoy, because if it's something you enjoy, you're going to be 10 times better at it, and it's going to be 10 times more successful. So I would definitely pick something like that, and never accept no for an answer. Always ask why, and push forward.
I love that. And always ask why. I think that's important too, because sometimes people are just like, no, and I'm like, okay, all right, goodbye.
Oh, one other thing too, I'm going to add.
Mm-hmm.
I found out, and this is so true, it's harder for people to tell you no to your face than it is over the phone or a text message or email.
Text message, so it's easy to say a no.
Keep that in mind. Yeah.
Confrontation is scary. That's why a lot of people are like, no, we don't have to have this meeting in person. I'll just email you.
That's right.
I'll just text you. And I'm like, oh no, that can't mean it's good. When people are like, we don't have to have a meeting. I'll just send you an email. I'm like, I don't think that's good then, because they get a lot more risky with their text and emails and stuff than they do in person. So
yep.
I think that's a very good point to make there. Well, I just want to say thank you so much for taking your very busy life and schedule to come in and sit down and talk with me. I just awed by everything that you've done in such a short amount of time. And I think that's awesome. Just incredible. You're so cool. So,
thank you.
Well, I will see you guys next week. Thank you guys so much for joining. And yeah, check us out on YouTube, Beyond Entrepreneur.